The Democratic Alliance says it strongly supports and advocates for COVID-19 vaccination as protection against hospitalization and death, but it is opposed to mandatory vaccinations. The party says evidence is emerging that vaccines are less effective at preventing transmission as waves of infections are still occurring among highly vaccinated populations. Talk to us more about this. I'm joined now by dear Head of Policy, Gwen Ngwenya. We'll be joined shortly also by University of KwaZulu-Natal's Chief Medical Specialist and Dean of the School of Nursing and Public Health, Professor Musa Mushabela. Gwen, good evening, and thank you very much for your time and joining us tonight here on In Focus. So, tell me more about this extensive public health expert consultation that you embarked on. What were the key issues discussed in this consultation that informs your position?
Well, I mean, it was essentially on the central issue, which is should COVID-19 vaccination be made mandatory? And, you know, it's interesting because globally, this is a conversation that is happening, and it's not very particular side, but particularly in those experts who do believe that this is the right way to proceed. We can see those conversations happening in Germany. The FDP there, which is one of the coalition partners, has also tabled a motion that is opposed to mandatory vaccination. We also see that at Oxford University, their director for the Centre of Practical Ethics has also warned against mandatory vaccination, and you've even got WHO advisors talking about the public health response or risk in mandatory vaccinations, and that they may actually make those who are already hesitant even more hesitant. So it's just a combination of looking globally at what the public health policy response has been. And the essential factor, which then the decision fell on, was what is the social risk or harm that a mandatory vaccination policy would be seeking to address? And that harm is essentially the extensive pressure on the health system and hospitalizations, via hospitalizations. And at the moment in South Africa, there is no significant pressure on hospitals due to COVID. Of course, the picture may change. That's why we're quite clear in having a disclaimer and saying, as more information comes to light, etc., this position may be adjusted. But at the moment, we don't think that the public health reasons are strong enough to justify a coercive public policy response. All right, Professor Musa Mushabela joining us now, listening to that conversation. Prof, one issue being raised here is that COVID-19 vaccines do not protect against transmission. And does the DA have a point here?
Yeah, greetings to you, Thabo, to the panelists and to the listeners as well. No, we do know that vaccines do protect against infection, and we have studies that show that you get up to 40% protection from infection. And that is not the only benefit. As we know, that the greatest benefit is with protection from severe disease and also from death. But with the burden of long COVID that we have in people who suffer mild disease, it's really important that we think about how to maximize the benefit of vaccination.
Why are we still then seeing waves of infections still occurring amongst the highly vaccinated population?
Yes, we do see infections happening, and that is not necessarily not to be expected. As we said, there is people who, there's a proportion of 40%. There will be a whole lot of 60% of people who are vaccinated who can be exposed to infection. And also, even in terms of severe disease, you can still get up to another 20% or so of people, depending on which vaccine you've taken, who can get infected. And even for protection from death is not 100%. But actually, I don't think that the aim is to have 100% protection, is to really reduce the burden of infection, of disease, and of death from vaccination. And I don't think that there is any dispute in terms of immunity protecting people from the burden of disease.
Yeah. Does that then go to say that, well, then don't have a public health policy that says be vaccinated or you won't be allowed into public spaces?
Yeah, I think that, when we think about policies around how to encourage vaccination, whether it's incentives or disincentives, the aim of those policies are to increase the coverage of vaccination such that we can have higher levels of immunity in the population. In my view, I don't think that those policies are meant to be permanent. they are really interventions to try and stimulate vaccination. In South Africa, we only have 40% of adults who are fully vaccinated and 27% of the population, total population, that is vaccinated. These are very low, and it makes it very risky when we start to compare with countries that have very high levels of vaccination coverage.
Yeah. Your position, Gwen, though, argues that these numbers are not taking into consideration that there's a vast number of South Africans who've already infected the virus and have now built natural immunity. Am I correct?
Yes, but I think it's also very important to separate out two issues here. One is the strong support for COVID vaccination, which is what the policy emphasizes, precisely for the reasons that have been highlighted, that it protects against severe disease and death. So that is a very strong reason why individuals should be going out there to get vaccinated. But to make it a mandatory policy, you have to look at whether or not there's a significant enough social or public risk to justify coercion for every single person to be vaccinated. And what we're saying is that the justification, if there could be one for a mandatory vaccination policy, would be that the health system is so overburdened that at least this has been the justification for those considering it, that we need a mandatory policy. But we are saying that the health system is not so overly burdened at the moment that is required. And that furthermore, as you are saying, over 70%, we have been informed by epidemiologists that over 70% of the South African population has likely immunity from either being vaccinated or from natural immunity due to prior infection. And so therefore, that's why we say that the group that we really want to target are those who are over 50 years old and who have comorbidities and healthcare workers perhaps. So we need to better target our response for vaccination to get much higher vaccination rates amongst the vulnerable population, as opposed to going for a target of perhaps universal coverage amongst the general population, which is unlikely to happen. But that in combination with that, lastly, is that we do have to have more educational awareness for those who are still hesitant, but also most importantly to take vaccines to where people are. Yeah. We think one of the big shortcomings is that, of course, if you live in relatively wealthy areas, suburban areas, you might feel that, a vaccination site is quite close to me. But we have been seeing, in some provinces, people who actually a vaccination site is out of their way. And if we can place pop-up vaccination stations in taxi ranks, in shopping malls, etc. Take the vaccines to where people are, and to stop the strategy of expecting people to go to the vaccines.
Yeah. Prof, can we completely rely on that 73% of the South African population with some degree of immunity?
Yeah, I think that to some extent we can. I think one thing to note is that whenever people get immunity, it doesn't only stimulate antibodies, it also stimulates their T-cell immunity. And that cellular immunity seems to be, in a way, durable over time. We're yet to see. But certainly the antibody arm of the immune system is not durable. It wanes after a few months. And also, personally, I don't necessarily think that relying on infection immunity is a good public health strategy. I think that we need to be intentional. Even with people who have had infection, they benefit a lot when they get vaccination. That's the one thing. And I think the other thing that's important is that, we do want to make sure that people have access to vaccinations, education. I completely support that. Access to vaccination, I completely support that. But I also think that sometimes we look at mandatory policies as if they are extreme kinds of policies. I don't necessarily think that it's a policy that's going to force a vaccine in someone's arm. Yes, it does carry incentives and disincentives, but I do think a combination of those approaches is not an either or. It's not that you only go for mandatory vaccination and that's it. You actually need to think about how to combine education with access, with some policies that can disincentivize, some can incentivize. And also, I think that we can do it in a way that is targeted. I don't necessarily think that when certain companies do it, it's wrong compared to if, for example, you were to deny people basic food or basic healthcare services. I don't necessarily think that we need to see it as extreme. We have to actually think about strategies on how to encourage vaccination. And we know now that education and access alone are not enough. We need to have policies that would really incentivize or disincentivize people. Otherwise, we need to be really innovative and think about what are the better strategies to get us to close to 80% of coverage. And we must not wait until we have a wave in order to increase vaccination. We must do it before we have a seasonal increase in infections.
Gwen, what do you see as a Democratic Alliance as an incentive for people to get vaccinated?
Yeah, I mean...
sorry, Prof, just going to respond there.
No, I'm quite happy for the Prof to come in, because we haven't specifically proposed incentives, but we have been saying that we should make access easier and to encourage also educational, awareness programs. I don't, if I'm happy to engage with a conversation around incentives, although I think it starts getting a bit dubious if you talk about financial incentives, but I'm sure there's a whole gamut of different types of incentives that could exist. But that so far has not been the stance that we've been communicating, but rather focusing on access and, to focus on access primarily and education.
Yeah. From policy position then, I mean, what is your feeling around institutions of higher learning who have made it mandatory? There are some companies, private sector, who have chosen that this is what they will do in their businesses.
Yeah, I do think that when it comes to workplaces, employers do have a duty to ensure that there is occupational health and safety, and they need to do what they can. Personally, I don't necessarily think that people need to lose their jobs or for students not to be able to have access to education. But I also think that we need to learn to have personal responsibility to ensure that certain interventions that we take, like vaccination, sometimes even if you feel like, you can get away without getting a vaccine, but it helps to do it for your colleagues, to do it for your family, to do it for your clients and so forth in order to ensure that people are safe. There is a lot of anxiety around people getting infection. If I can get away with a mild infection, it doesn't mean that the next person who may catch an infection from me, given that this is an infectious disease, will get away with a mild infection. That person can end up with severe disease and can die. And we need to think about how to promote that culture of responsibility. So I'm not really opposed to policies that encourage people or disincentivize people who are not willing to vaccinate in institutions of higher learning or in workplaces. I just think that it's something that needs to be done by consensus, people understanding the responsibility to ensure that we protect each other, but also to ensure that those institutions can function. For the most part, many of those institutions have been paralyzed, and they all want to be active. They want to be economically active, and vaccination and security around vaccination can get us there.
Yeah. Gwen, what does the DA say to that?
Well, I think for us, another consideration was that the fact that the vaccines do not provide obviously 100% immunity against infection, as the professors highlighted. So on that basis, you can still become infected or infect someone else even if you are vaccinated. And that is the reason we then said, well, if infections are going to happen, then really the primary benefits of vaccination, and the reason why I want to stress again, we are strongly in support of vaccination, is to prevent severe disease and death. And so on a personal level, it's strongly encouraged for everyone to get vaccinated. But if we, from a public health response, if vaccines do not provide, if those who are vaccinated can still spread the virus and still be infected, then really it means that what we need to maximize is, the ability to protect against severe disease. And at least many of the, as I was quite open about from the beginning, you can obviously speak to experts who will fall on the other side of this debate, but a great many we also, spoke to really felt that is really the crux of the matter, is the public harm or the public risk, great enough to justify a coercive response. And I think we'd be having maybe an entirely different conversation if we were talking about a vaccine that is 100% effective against transmission and infection, and a vaccine that conferred lifetime immunity. But that is not the kind of vaccine we are talking about. And so I think that doesn't justify then the kind of coercive response that we might otherwise have.
Head of Policy for the Democratic Alliance there, Gwen Ngwenya.